people popping in.
And Commissioner, this is Leanne. Last time I checked, we had 125 people registered for this webinar.
Okay, well, we have people popping in, so.
Yeah.
So you give us a signal when you want me to start, or?
Yes.
Okay, that sounds good.
It looks like we have about 50 people in, Ernesto, so maybe you do want to get started. There's a few more folks popping in, but we got the bulk of the ones that are registered now, and they can keep entering as time goes on.
Okay. Good evening, everyone. Welcome to this BHA virtual town hall. Thank you so much to Congresswoman Donna Shalala, Representative, State Representative, Senator José Javier Rodríguez, State Representative Nick Duran, and our Commissioner of District 5, Ms. Eileen Higgins. 3 points of interest that we have, aside from other issues that we're going to cover today and tonight, is that Census 2020 is extremely important for our community. Secondly, voting registration. We need to motivate our base, to the young people, to go to the polls. This is an important year for elections, and we need to motivate the young people to go to the polls, definitely, to let the right people in the right positions that we need. And lastly, right now, the omission by the Small Business and Administration of the Community Association workers, more than 60% of Floridians nowadays, they live in community associations. And these workers, low-paid workers, they have not been recognized of their needs by the Small Business Association. So without any further delay, I want to thank all the staff involved here. A special thanks to Camila and also to Leanne for putting up this event, also to Avi and to Sam. So the floor is on for the panelists to move forward with our agenda.
Right, and this is Nancy with Commissioner Higgins' office. I just wanted to welcome everybody quickly and do a little bit of housekeeping about our Zoom tips. So we have the Q&A feature activated, so you'll see it at the bottom of your screen, and we would love to have you submit your questions there. Straightforward questions we're going to be able to answer throughout the presentations, and then questions that are a little more lengthy or complex, we'll be fielding those to all of our different panelists in the question and answer section, which is happening at the end of all the presentations. We do not have the chat feature on at this point, nor do we have audio or video for participants. So you'll just see the panelists, and you'll have your opportunity to submit Q&A, and we will, anything we can't get to tonight, I'm sure all of us will be following up by email or other methods. So thank you very much, Ernesto, for having.
Hello. Hello.
Hi.
Is that Sam?
This is Sam. Can you guys hear me?
Yeah.
Ah, finally. I'm so sorry, everybody. Thank you very much for getting started and going. Before we get to our presentations, I just have just a couple of quick announcements. First, I want to thank everybody for coming out and being a part of what is the first of what we hope will be many of these kinds of sessions over the coming year. I want to thank, first of all and foremost, Congresswoman Donna Shalala, who actually about a year ago was the catalyst for this event happening, and really talked about how do we bring together all of the stakeholders in the urban core to really talk about our issues. So thank you very much, and we look forward to taking you up on your offer of being with us more often, hopefully throughout this year. I also want to say a quick thank you to First Miami Presbyterian Church that was going to host the original event, and we will have a live town hall, we hope, soon before the end of the calendar year, crisis permitting. But they were very gracious and excited about doing this, and we're excited about doing it live also. I also want to thank our co-hosts, Downtown Neighbors Alliance, the Rhodes Miami Neighborhood Association, Brickell Area Association, and actually all of the associations in the core, even though they're not named here, have been helpful. The DDA and Commissioner Higgins in your office have been unbelievable. Camilla and Leanne, this would not have happened without you guys. And same goes with our presenters and your staff. We are represented by some of the best talent, I think, in the country. And all of your staff represent you very, very well. Thank you, Raul, Nora, Yolanda, all of you for your help, and obviously Ernesto and Abby.
Exit out from wherever, because I hear.
That's all I had. And I'm going to pass the floor over to our keynote speaker, who we're very excited to hear from our own home. And I think, again, one of the best representatives out there in the country, Congresswoman Donna Shalala.
Thanks very much, Sam. I'm happy to be here with everybody, and thanks, Ernesto. Thanks to all of you and to my colleagues in state and local government. We're a team, and our job is to make sure we answer your questions and that I tell you what we've been able to do in Washington to help our community. We haven't been able to do everything, but we have been able to bring free testing to the community, though not enough. And we have been able to bring small business loans and grants, as well as unemployment, money for unemployment. Both of those programs have not been executed as well as we had hoped. The state simply had an old-fashioned program, and my colleagues can talk about it a little bit, and the SBA was just not ready through the banks. The big banks took care of the big guys first, but now they're focused, and the smaller banks are certainly focused on the real small businesses in our community. But I'd like to talk to you a little about what to expect in the future. And the first one is what my colleagues and I have been waiting for, and that is the next care package will include, I promise, money for state and local governments, but in particular, we will bypass the state to give the money to our local governments, because we don't want the state money to be held up in any way. Second, I have asked for another round of $1,200 checks. It seems to me, with the slowness of the unemployment insurance and the small business loans, that we need to get everybody some money in their pockets. And so I have asked the Democratic leadership if we can do another $1,200 check. That, of course, is $2,400 for a family up to $150,000 plus $500 for each child. Most of you who were eligible have gotten your checks already, but I think we should put some more money out there. Funding for the mission-driven community development financial institutions, which lend to hard-to-reach small businesses, often in communities of color. We believe it should be increased dramatically. And we want to increase the SNAP benefits. And I hope that many of you are taking advantage of these benefits. The SNAP applications are available at the libraries that are distributing unemployment insurance applications in our community. I hope that's right, Commissioner Higgins. I'm looking at Commissioner Higgins right now. But more importantly, SNAP benefits, many of you have never applied for SNAP benefits, but you need to apply now. It's the former food stamps, but it's a much more modernized program in which you get a card and you'll be able to use it at everybody, including Walmart, to buy groceries. We put money into the schools to provide school lunches that are grab and go. And I think our school board has done a terrific job for getting food out, particularly to the children in our community. We vastly expanded Meals on Wheels, and I hope everybody who needs Meals on Wheels calls 311. If you're 65, you're eligible. Don't worry very much about income. Just if you're 65 and you're living alone or with a family member, you're eligible for a Meals on Wheels. We're going to be discussing blanket protection against eviction and strong legal safeguards against utility and broadband shutoffs to ensure that people are not left on the streets. That will be federal legislation that we're working on. The county has already done a number of things, as has the city. We're going to talk about emergency housing grants to provide direct rental assistance with assistance for small-scale landlords to prevent further community distress. And we've got to do something about testing. No state in the union has passed the first stage of the CDC's requirements. We just don't have enough testing in our community or in any community in our state, and we need to do more with testing. And the fatality rates are varying by cities, but big urban areas like ours are really sad places these days. We have too many of our fellow citizens who have passed away. I'm very worried about nursing homes, and I'm going to focus like a laser on nursing homes in our community and across Florida. But my top priority is to ensure that everyone that needs a test gets a test. We have to test deeper in our community and to make sure we get these cash assistance out as quickly as possible. Let me say one thing to end up. People should not be shy about taking advantage of these benefits. It's your tax money, and all your Congresswoman is doing is bringing it back to you. And we're bringing it back to you through a variety of programs, but keep thinking of it as your money, because it's your money, and it's time people in our community got their fair share back from Washington. So that's exactly what's happening. It's in a, the relief is being introduced in a variety of ways. I'll be happy to answer questions a little later about COVID-19 and about the various programs. But right now, I wanted to give you an opportunity to hear from the rest of my colleagues. Thank you very much.
Thank you so much, Congressman Shalala. We look forward to the Q&A session because I'm sure folks have a few questions about some of the initiatives you mentioned. Next on the list is our guy up in Tallahassee, one of them anyway, who's always looking out for associations, for Brickell, for downtown, the urban core, and the thing nearest and dearest to my heart, the environment. It's a pleasure to have him here. We haven't heard from him for a little while, so I'll turn the floor over to Senator José Javier Rodríguez.
Hi, everybody. State Senator José Javier Rodríguez. It's an honor to represent the downtown core, including Brickell, in the Florida Senate. You know, everybody's doing their part. So I want to thank you for everybody who is doing their part during this crisis. It's difficult for us, but for us, or at least me personally this evening, to see some friendly faces, I think is some solace in this crisis. I've been asked to talk about the economic reopening and unemployment benefits. I think you can see some slides there. Maybe if you go to the one of the slides. Thank you. So again, thanks to the VHA and the partner neighborhood associations and Commissioner Higgins for bringing us together to discuss this. Please don't hesitate to reach out to me. First of all, my contact information is on the slide, the number for my office. I have great staff. We're very diligent on constituent issues. My email is there. Please don't be shy if there's anything that we can help with or any questions you may have. There are 3 links that I've shared and a phone number on the slide. over 900,000 Floridians have applied for unemployment benefits since March 15th. And this is frankly a travesty. It was a bad system before the pandemic. So even prior to the pandemic, we had the worst unemployment system for out of work people in the entire country. When you measure the level of benefits, as well as the accessibility of the application and the system itself, that's only gotten worse since the crisis. Yes, every state has had a large volume, but here in Florida, it's been exacerbated by the fact that there's a lot of lost time. This is the slowest state in the country in dealing with the backlog that we have. I don't want to get too much into polemics, but a lot of us have been advocating for reforms for a very long time. And it really has been kind of an ideological issue in Tallahassee, which I hope we'll overcome given the current situation. Many rules have been waived. There's been a lot of changes, although very slow relative to what they should be, and frankly, relative to even other states as close as Georgia to the north. This kind of big picture explanation does not help individuals, obviously, for those people who are out of work and need the benefits. The economic crisis that came along with the pandemic has hit us fast and furious. There is no precedent for the speed with which the number of job losses that we're experiencing has happened. So I want to encourage those people who are struggling through this horrendous unemployment system that we have here in Florida and offer encouragement. The first link is the application. Those of you who've been applying are very well aware that the application has had serious problems with it. The second link is for appeals. Many people have been receiving denials from the Department of Economic Opportunity with their application. If there is a determination made, and the DEO, Department of Economic Opportunity, should be making determinations on applications. If they haven't made a determination, that's not correct. They shouldn't deny you just with no determination. But if they've made a determination, you can make an appeal. That's the second link. And I would encourage folks to engage with DEO, log into the portal and see what reason they're being given and try to appeal it to overcome that in getting benefits. The third one is important, and I apologize, this takes a little bit of time because it's complicated. Thanks to the CARES Act, which was the March 27th federal action, bill that adds to the benefits that Florida has, also created a program that includes people traditionally not covered by unemployment, gig workers, independent contractors, those who are self-employed. It's taken the DEO, the department that runs the unemployment system, over a month to finally implement this program. And what I will tell folks is many of the denials are people who do actually qualify for this PUA program that's supposed to be kind of a catch-all and includes independent contractors and gig workers. And this is embarrassingly ridiculous to have to give this instruction, but if people are not already aware, for those in that category, if you applied on or before April 4th, DEO is telling you, start from scratch, apply all over again, you will be denied, and then once you're denied, you log into the portal and there will be an application for you. That is embarrassingly ridiculous. That is not the advice people should be getting a month and 2 days after the CARES Act passed, but that is where we're at. If you applied April 5th or onward, and you qualify for that program, you will have already received a denial. However, if you log in the portal, there should be a link for you to apply for the PUA program. That's where we are with unemployment. There's a lot of things I could go into, but one of the things that we've asked for, and we're now 22 days later after Governor DeSantis said that he's open to a retroactivity rule, that's something we're going to continue advocating for. Retroactivity, again, the system has been either basically down and inaccessible for large parts of our economic crisis, or has been very cumbersome and very difficult to use. For that reason, again, the governor agreed 22 days ago to some sort of retroactivity so that people are not held harmless for the fact that they couldn't apply for a period of time. We still do not have a rule on that. The governor still has not given us that, although he's promised us, again, 3 weeks ago that he would do that. I'm happy to answer questions in this forum or another, but I'll move on very quickly because I know others are going to give very valuable information as well. But the second piece that I've been asked to speak to is the state economic quote unquote reopening. And I just say quote unquote reopening because, when local and state governments were taking these actions to ask us to stay at home and to close or ask non-essential businesses not to operate, none of this was permanent. So with respect to the quote unquote reopening, there's a task force at the state level that has been meeting. They've made a recommendation. However, the ability to comment to the task force is still an option through tomorrow. So for those who want to understand what the discussions are on a state level with respect to the state phased reopening, there are links on there where you can go and listen to a library of the deliberations of the task force and a link so that you can make a comment, should you want to, on that task force. The last link is a link to the Florida Department of Health's portal. This portal gives aggregate data for what is happening across the state, as well as in our own county with respect to the COVID-19 pandemic in our state. And it has a lot of other resources, up-to-date information from the Department of Health and from the CDC. I just want to quickly touch on where we're at in terms of that reopening. Statewide, effective Monday, May 4th, elective surgeries can resume. Restaurants can offer outdoor seating up to 25% capacity, and patrons have to stay 6 feet apart. Retail businesses can open at 25% indoor capacity. This is again statewide, and there's a very important qualification coming up in a second. What the state will not be doing as of Monday, as of phase 1, visits to nursing homes and long-term care facilities are still prohibited. Schools will continue distance learning until further notice. And of course, and there's probably should be no surprise to anyone, gyms, barbershops, hairdressers, bars will remain closed. None of this applies to Miami-Dade, Broward, and Palm Beach County, whose closures remain in effect. I will leave it to Commissioner Higgins to elaborate on what Miami-Dade County is doing. The city of Miami, there's a city commission meeting going on right now. I don't know if they are deliberating, but as of my information right now, the city of Miami has not yet considered any opening, but Miami-Dade County is opening certain parks. But again, the statewide closures that I'm mentioning being reopened as of Monday do not apply for us here in Miami-Dade. In Miami-Dade, it's being left to us here locally to decide when and how to reopen, at least for now. We're in quote unquote phase 1. Happy to answer any questions either here or directly to my office. Thank you for your time.
Thank you, Senator. Next, we want to move on to our other guy in Tallahassee, State Representative Nick Duran, whose office, again, actually all of these representatives, I think the words that come up are competent, thoughtful, empathetic, and they follow through. So without any further ado, Representative Nick Duran.
Good evening, and thank you, Sam. And let me echo what both my colleagues prior to me had said. I'm hoping all of you are safe and well. These are certainly trying times. These are unique, and this is certainly a new challenge for this community, this neighborhood, our state. And so it is good to be with you to talk through some of the things that we're listening to, we're learning, we're hearing, and what we know. And at least with a little bit of more insight, we can help you feel a little bit more comfortable in where we're going and hope to be over the next several weeks. And I think Congresswoman Shalala has said it best. We are teamed up. We have all been coordinating. Our offices have been coordinating very closely since this pandemic began, and we all found ourselves operating from our homes and getting constricted to where we can be. And so we are all coordinating from the Congresswoman down, up and down and across with both Commissioner Russell, with Commissioner Higgins, and the Senator. We have been meeting to share what we are all hearing, so that when we talk about federal issues and interest concerns, or state issues and concerns, we're all sort of information sharing so that we can be more empowered to make some smart decisions and influential conversations with those around us. So I have been asked to dive a little bit into the SNAP program that Congresswoman Shalala had kind of talked a little bit top line on. And I think it's important for us to just take a few minutes to talk about this program based on what the Senator had just said, that we are dealing with an incredible number of unemployed for our state, historic numbers, and the largest number of unemployment claims are actually here in Miami-Dade County across the state. And so what we are seeing and knowing is there are a lot of folks in our communities who are struggling to make ends meet. And so what we wanted to do is ensure that you at least knew that there are some programs within the state that are federal state programs that are there for our families and communities, programs that we know are actually, there aren't any issues with enrolling into at this moment in time. And one of those is the SNAP program, which stands for Supplemental Nutrition Assistance Program. This is a federal program, federally funded, but it is administered by the state Department of Children and Families. And for those to qualify, you have to have a gross income of less than or equal to 200% of federal poverty level. I think we have an example here on the slide that's about, for a single person, that's about $2,000.82. For family of four, it's about $4,292. And really, the benefit max, and we'll talk a little bit about some of the movements that we have made at the state level to ensure that this program is being leveraged to its full extent for families. But it does depend upon the income and the family size. And the way it works is you do get an electronic benefits card, similar to like sort of a debit card that you can use in food and grocery items. Can't use it on alcohol or cigarettes or anything of that nature, or hot foods. But the website is here on these slides, and I think all of these slides also have something quite critical and important. They have my contact information, my email address. You can get a hold of us at all of these three: the phone number, the email address, and my Twitter handle. All three of those. So I'm happy to answer more questions here, or if you find something later on down the road, or if you're going through the process, please make sure you reach out. The other important issues that I wanted to point out with respect to the SNAP program, and here's actually something that I found fascinating, because with respect to the SNAP program in April, we had about 1.5 million total Floridians who had enrolled in it. And I went back today and asked them about where we are, and we are actually at 3 million people. So there are a lot of folks who are taking advantage of this program, and we want to make sure that they do. Because it's quick in terms of how they get that funding to you. Some of the things that they did change to make it a more seamless, more easier program for you to get a hold of and start using, they waived these work requirements. There have been some work requirements that they have always been a part of the long-standing operation of this program, but these have been waived during the course of this the pandemic. They have extended certification. So if you are already in the program and you're about to term out, they have extended it 6 months to provide you with more time to renew. No one's going to slip through the cracks. They're not going to allow folks who are currently in it to slip through if that's the case. And the Congresswoman was right that this was something that just changed a few days back, that they are now doing ability to purchase groceries online. I know Walmart and Amazon are the two major providers on this issue. And so you can definitely do that as well. And as I mentioned before, your max, when they sign you up, what they're going to look at is your family size income, and they're going to make sure that at that level you are getting the max amount of the benefit that they can provide. And there's and I think the Congresswoman was mentioning that they may increase the amount of funding support that will come with that. So stay tuned on that level as well. There's a couple of ways to apply. There are paper applications at the public libraries. The actual online system is actually it's actually much different than our unemployment system, and that you're going to go there and shake your fist and have a lot of issues. This system has been built in a way that it's been it's fully operational. The phone lines are also you will get a hold of somebody and be able to enroll through the phone lines as well. And we also know that what they actually did, and they have built out capacity on the phones and their call centers in a way that you're not that's really providing an easy route to that and getting there. Some other issues that I think this is what I wanted to really kind of streamline and make sure that you all had the access to this information. And I don't think there's another slide. I just want to make sure on this issue. Yes, food distribution. So that's a portion of what we're doing. I think there's some other critical things that we need to point out. Food distribution, farm share distribution. Farm Share is a nonprofit organization here in Miami that has been, it's a statewide operation, but here in Miami-Dade, they have been really, really critical to ensuring folks across our county and communities have access to groceries. And what they've been doing is the way that the system has been, we've been coordinating with them. They have been doing the yeoman's work and the backbreaking work of getting this food to particular locations at particular times. This website right here, if you went to it, it is populated every day with a new event that's coming on that you can go to. And the way to go to these events is there are rules right now because of the pandemic with respect to distribution that it is car. So you have to be in a car and go through the line in a car, and then they put it in your trunk. And we did this yesterday, not too far from the Brickell neighborhood in Coconut Grove. But there are several of these events going on and going to continue to go on. And so I'd encourage you to take a look at this website if you're looking for or need an access to food. Also, with respect to Miami-Dade County Public Schools, and they have since day one, since the social distancing measures and the stay-at-home measures have been in place, have been working to ensure that the meal program that they have at their school system continues. If you go to this website here, the freesschoollunch.info, it will put up a map. You can put in your zip code. You'll find the closest school to you, and they are distributing meals. They're not going to ask you if a family member comes in or anything like that. They are not going to question you. They're going to ensure that you get a meal. And these are pre-prepared meals as well as everything else that's being very safely done. And so there's another access there. These are not the only limited places. And I'm sure Commissioner Higgins, who's been really at it on the local level with the county and some of the programs that they have, like 311 for our older and elderly families, who we're ensuring our elderly population does not go hungry as well. But there are several other areas and locations that are providing food as well. I think the Miami-Dade County website as well has a couple of important places that she might be able to bring up as well. I'll move on and I'll stop talking so we can allow our other speakers to come on, and I'm happy to talk some more. Some really top line items on the budget, because the senator and I were actually in Tallahassee, and we had to go and pass the budget right around March 13th was supposed to be our last day. We came back the following week and passed the budget and came back home. And that was the budget that I think you would say in it was a lot of exciting and important things. We had fully funded for the first time the Affordable Housing Sadowski Affordable Housing Trust Fund, something that as we have not done in this state for years. Prior to the first back in 2009 when the economy collapsed, that's when we started using it as a cookie jar to fund everything else, and it became a bad spending habit. And so this was our first year where we, as a bipartisan sort of approach to this, said no more using that as our cookie jar. Let's realize that we have an affordable housing crisis, and the leverage of those funds from Miami-Dade is critical in how we could use it. So that was an important part of that budget. The other thing that we did in there was a $500 million investment in our teachers and bringing up their salaries and school personnel salaries is something that we did as a state for the first time. So some of the issues that the senator, myself, and many of the other folks here, our colleagues, have been sort of banging the drum, steadily banging the drum and reiterating time and time again as we go back up to Tallahassee, we had seen in this budget. Now, the only issue I would say is this is a budget that does not largely reflect the realities of right now and in what we're dealing with. This pandemic has certainly and will impact the state's coffers, our county and our city coffers as well. And so there is a chance we may see some of these things that we may have to go back up to Tallahassee prior to July. July 1st is the start of the fiscal year for our state, and it runs to the June 30th. That's our fiscal year every year. And so we have been waiting. I think the May, this month coming up, is when we start to get some of the real numbers for the state. Our chief economist takes a look, and it may compel us and compel a real move towards having to go to Tallahassee and make some revisions. Our hope is that these items that we just mentioned to you stay there. And I think that there's a compelling argument to be made by all of us that they should stay there in this particular circumstance that we are finding ourselves in. And as many of you know, I have 2 children at home, and I cannot tell you now, after having a lot of the homeschooling and being my wife being the cafeteria lady, the school resource officer, the principal and teacher, and me putting people in groundation, that we have to value our teachers for the work that they do on a day in, day out. It's just been so relevant and to see it and have to go through what we're doing right now. So we'll keep monitoring on these issues with respect to where we go with this budget. But there were some big wins. My hope is that we can maintain those wins even in light of what we have in front of us, the challenge that's in front of us. Thank you, and I'll hold off and wait until we can do some questioning and answers as well.
Thank you very much, Representative Duran. And being the superintendent in my household, I know where you're coming from, and I do. Like you, I thank our teachers and hope all of them will stick around because I want to give her back as soon as I can. Next, I want to introduce our representative on the county commission, Commissioner Eileen Higgins, who is one of us, a neighbor, a friend, someone we see on the bus and on the train, traveling like we do. We appreciate that. It means a lot. But I will tell you that her staff mirrors her compassion and passion for this work. So thank you very much. The floor is yours, Commissioner.
Thank you, Sam. Thanks, everybody. And it's great to be here with all of my colleagues. We get together once a week, and I call it the up and down meeting, where it goes all the way up to Congress and all the way down to me and Commissioner Russell at the city level. So our coordination, as we're able to feed things we're confronting to the right level of government, has really been pretty amazing. So let me just quickly give you an update on the state of a couple of executive orders at the county level, and try to explain a little bit about some of the nuances as what that means to us as City of Miami residents. So as Senator Rodríguez explained, the governor has really given broad ability for every county, for many counties in the state to open, with the exception of South Florida. The 3 counties, Miami-Dade, Broward, and Palm Beach, have been carved out. And instead, we have the ability to make our own decisions about when is the right time to begin softly and slowly taking those baby steps towards reopening. There has been really good coordination between the 3 county mayors, Miami-Dade, Broward, and Palm Beach, about how this might be paced so that no one is really out of sync with anyone else. So the emergency orders for the county, the shelter in place, safer at home, whatever we want to call it, everybody should continue that we're, thinking that we're all safer at home for a very long time. The Congresswoman talked about the need to scale up broad scale testing. So until we have that testing and a vaccine, we're just not going to be able to go back to freely roaming around the way we did. We are protecting each other by trying to stay and work at home as carefully and as much as we possibly can. wear a mask. Right now, the mask wearing rules are pretty specific. If you're in a grocery store or pharmacy, absolutely if you're on any transit. And then as of yesterday, if you are in any county parks. And what you're starting to see is, I think, this slow realization that in addition to being careful about trying to be socially distant for a very long time, should we move to open our economy more, we should all expect to be wearing a mask when we leave our houses. It's a sign of respect. That's kind of how I see it. I have not left my house in over a month without wearing one, and yeah, they're hot. But I know that when I'm wearing my mask, I'm protecting you, and so that's what I'm doing. But the county mayor has made a very specific, and it was a 3-week process that involved the League of Cities, all 34 municipalities in the county, to talk about what might be the best approach to opening open spaces, which is probably the lowest risk soft opening we could come up with. And so as of Wednesday, the county has opened and has given permission to municipalities to open golf courses with a ton of strict rules. I mean, even to the point of how a soda might be delivered. They have also given permission to municipalities to open marinas, again, with very strict rules. And then they have given opportunities to open parks, again, with very strict rules, not for any contact sports, essentially for passive activities where we're walking. So that happened on Wednesday, and what you will notice is the city of Miami has chosen not to open their parks, and that's fine from the county's perspective. If your municipality isn't ready and bear in mind, we have several municipalities that didn't feel ready. It's not just the city of Miami. Some felt that they didn't have the police resources to enforce social distancing. Some people didn't feel like they had the personal protective equipment that they could provide to parks employees to also enforce social distancing. So there's lots of reasons why communities are choosing to delay the opening of their parks. And that's just fine with us at the county, right? Let's remember our county parks are big and they tend to be in very suburban areas. And so we opened all of our parks yesterday without incident. And then Miami Beach also opened most of their parks without incident. And I was out doing masked inspections of them. And I will tell you, people, I think we as a people have changed. And the reason we closed the parks is we were not behaving properly, right? So that's, so that's kind of where we are. We'll go back to the previous slide, I think. Thanks. So it's been very thoughtful. You will find that the city of Miami is going to make their own decision in pacing, just like the city of Hialeah and city of Coral Gables are. So the county is permitting it, but not forcing any community to move ahead of where they feel comfortable doing or whether it's resourced, right? Let's remember our local governments, to Congresswoman Shalala's point, are going to be resource lacking when it comes to financial stuff. Other thing, going back to what Rep. Duran was talking about, food and food security. One of the things the county did from day one was the minute we declared a state of emergency, we opened our 311 lines and we said any person over the age of 60 can get a week's worth of meals delivered to their home every week until we're out of this. And the reason we did that was we wanted to make sure that the population that we knew was at the highest risk for getting this infection and getting seriously ill from it were people over the age of 60. And so we have delivered, I think we're almost at 2.5 million meals since March 12th. And to this day, if you know anyone over the age of 60, we don't want them in the grocery stores. We want them at home. And we will deliver a week's worth of meals to anyone. You just call 311. We'll ask you about some dietary restrictions. But I think if you look at the state of Florida's curve, Miami-Dade County's curve is on the younger side of the infections. And any infection is bad, but any infection of anyone over the age of 60 is a lot worse. And so we really have done a great job at keeping thousands and thousands and thousands of seniors in their house. And it doesn't matter if you're poor, rich, whatever. If you would like to stay out of the grocery store, we will deliver this to you. Testing has gotten a lot better for us. I mean, it's still not universal, but if you call, if you're homebound or disabled, City of Miami Beach, City of Miami, the county, you can call and someone will test you in your home. And then we have a lot of drive-up sites, and most of them we have moved to a much broader testing criteria. We're testing asymptomatic people who might have been in contact. And so we really are able to crank out thousands of tests, a day. And we just opened our first walk-up test site. That, as you know, is very difficult. It's hot as can be. We social distancing. But we just opened it with low capacity because we need to test that. Don't think that anyone that didn't have a car was not able to get tested. Anybody that was sick, if they called our office, we got a fire department to go help them. So anybody that was experiencing symptoms or really felt that they might be encountering COVID, we have dealt with, whether or not they had a car. But we do need to figure this out if we move to wide-scale testing, because we have a huge percentage of our population, particularly in my district, who do not have cars, some by choice, but the residents that we all serve in Little Havana do not have cars by choice. So we do have to learn how to run a walk-up testing site. So that we launched this week, and we should be rolling out more after that. Okay, now you can go to the next slide. I think I told you about parks, so we've kind of done that. I have been out inspecting the City of Miami Beach parks and the county parks just to make sure that both governments are resourced properly. And when the City of Miami feels comfortable opening, they will make that decision to do that. And as I said, Mayor Jimenez is fine letting municipalities go at their own pace. We're doing a lot on economic recovery plan. I see Commissioner Russell's joined us, yay. So City of Miami has done some good things. And I'm working, again, thanks to the flexibility that the federal aid from the first round of bills came out that did come down to counties. I am putting together a, what we're hoping will eventually get to a $50 million revolving loan fund for small businesses in the county, because in our county, 53% of the jobs are from companies that have less than 25 employees. And guess what? Those companies have not been successful at accessing the SBA and the PPP loans. So I'm working with our mayor, with our chief financial officer, and we've got some public-private folks. So we should be in the next 2 weeks talking about launching a very substantial revolving loan fund that will be focused primarily on our smallest businesses, which that is the kind of economy we have here, is little bitty businesses employing hundreds of thousands of people. And so there's a number of plans, but that's coming down the pike, and we're very grateful, Congresswoman, that that money was flexible enough. And interesting, we talk about police, fire, EMTs, our hospital workers as frontline responders, but in the case of Miami-Dade County, it's our library staff that has been on the front lines. We have now for weeks had 26 branches open just outside for anybody that cannot print. Like, all these applications assume you have internet at home. And people don't always have a computer at home, and they don't have internet at home, and they don't have a printer at home even if they have them. And so we have made printed paper copies of anything you need, whether it's to apply for SNAP, unemployment, at our libraries. And then I'm super excited to announce that starting next week, all of our libraries will have the ability to do, drive up or walk up. You can put your hold or reserve your book, and then you can go to the library and they will deliver it to you outside. We're still not ready to open the inside spaces, but that they're getting back to sort of trying to provide for those of us that love books rather than always the ebooks. That'll be happening for you next week. And if anybody has an abundance of pet food, these kinds of crises when people lose their jobs are when they start to abandon their pets. And so you can drop off pet food donations right now at 26 libraries, next week at every library. And then we are doing pet food, drive-through pet food distributions because we do have residents that are struggling paying their bills, let alone and putting, so we need to feed everybody, our pets and our kids. So that's another service that the libraries are also providing. Right now, Shenandoah, the libraries that kind of, we've had half our libraries doing this. The one in Coconut Grove and then the one on First Street in Little Havana have been open, but by next week we will have Shenandoah, which I think will make a lot of folks happy. And then we will also have our main branch. Again, the inside space not open, but providing as many services as we can to folks on the outside. So if you see a librarian, thank them later. And then I think I may have one more slide, right? I can't remember. Oh yeah. I think Ernesto really and Sam really talked at the beginning of how voting is going to be different coming up. We used to call it vote by mail. I actually think we need to consider that in the coming months, it's going to be more about voting from home. So we really should, everyone should ask for a ballot. And you can go on and do it online. And we are hopefully we should be mailing a reminder about how people can do this online quickly. And hopefully any of you that live in associations, you can push that out through your newsletter. And then we also will be deploying our libraries to also have forms on site if anyone doesn't have online access and they'd like to fill out a vote by mail application. I presume in August we'll still be very nervous about, lots of people in places. I don't know about November. And our supervisor election, for those of us that love to vote in person, they're going to have in-person voting. And unlike other counties, she had it buttoned up on election day. I mean, I visited a lot of polling sites in March because I was very nervous about it. And, it was hand sanitizer, gloves, masks, and she ran a good job. And we have not had reported cases from any of the Miami-Dade polling locations, but nonetheless, voting from home is going to probably be our best option in August and probably in November too. Okay, next slide, and maybe this is the end for me. Okay, we're moving to Q&A, but I see my friend and colleague, Commissioner Ken Russell. He was doing commission business before. Do you want to say hello and say a few words before we?
Thank you for having me, and thanks, Eileen. Thanks for everything you do, of course. No, I'm here, and I'll let you believe I was doing commission business, or maybe I was doing daughter business, but I'm here now.
Well, we're glad you're here, because maybe we'll have some questions that'll be city related.
I'm here. I'm
Thank
available.
you very much, Commissioner Higgins, and Commissioner Russell, thank you for coming. We know you've had a lot on your plate and a lot going on, and so we appreciate you coming by. We had one little agenda error we skipped over, and so we're going to talk about the 2020 census, and I'm going to ask Camilla Patsula, I think I said that right, your last name, Camilla, to talk to us a little bit about the census. If you haven't done it already, you're locked away at home. Get online. It's very easy. It took me less than 10 minutes to get it done. Camilla, the floor is yours.
Thank you, Sam. And thank you everyone for joining us here today. So I just wanted to take this opportunity and remind everybody that the census is still going on. At the county level, we have reached about half of all households. We still have another 50% to go. In the city of Miami, that drops a little bit to 40%. And here in this slide, you can see actually what the census turnout looks like for your neighborhood, both Brickell and downtown. And you can see that the numbers vary quite a bit. And we're hoping that all of you can help us ensure that every single person in Miami-Dade County and in the city of Miami complete the 2020 census. The field work is on pause until June at the earliest, but what we want to push is everyone to go online or to complete it over the phone. If we can go to the next slide. And the reason why the census is so important, as we've heard about all these social issues that are going on and sort of the revitalizing of our communities, census data is used to allocate billions of dollars of federal funding. Each person represents about $1,800, whether child or adult, to the state of Florida for a year over a period of 10 years. That's $18,000 that we can use towards schools, towards programs like SNAP and Head Start, towards roads, transit, public health, community health centers, anything that you can think of that our community relies on to sort of live happily, safely, and healthy is in some way or another related to the census. So we really hope that all of you can help us push out this information. And our office at the County Commissioner Higgins office, we have a lot of resources and tools that we've developed so that we can digitally try to reach as many people as possible. So if you need anything, please reach out to us and we'll forward all the tools that we have and hopefully help you out and make sure that your neighbors and your friends and your family complete the census. Because as you can see from the turnout, we all know somebody, at least one person that has yet to complete it. So let's get out the word and get it done. And like Sam said, 5 to 10 minutes max. So I definitely think we can get it done over the next few weeks. Thanks.
Thank you very much, Camilla. And not only is it 5 or 10 minutes max, but remember also your information is private by law, because I know a lot of folks worry about that also. We're going to move on to the Q&A, but before we get started, we do have a couple VIPs who have joined us. First of all, we mentioned Commissioner Ken Russell, who in a minute, I'm going to give in a minute the floor to just talk about all the city has been doing since the crisis. And we also have with us Commander Ellington, who's joining us, our Brickell commander, who will be able to address any policing issues. But if you wouldn't mind, Commissioner Russell, if you'd take a minute or two and just briefly go over some of the things the city has been doing and its plans, and then we'll go on to Q&A.
Good evening, Sam, and thank you very, very much. I just wanted to follow up on what Camilla said about the census. The biggest incentive the city of Miami residents have for participating in the census is that as of the last count, we were at 480,000 people, more or less. I really believe that we have grown past the 500,000 number as a city, but we won't know that unless you fill out your form. And what happens when we reach that 500,000 mark is we become what's called a mega city with regard to the federal government. And that gives us a lot more direct access to the federal government with many issues from HUD and the homeless and housing. And these are things we all care about a lot. And as well as we work together with the county and the state, the more direct access we have for these resources, the better. So please, please, please fill out your census form and get those numbers up. I know we're past 500,000. We just need to show it by raising our hands. I'll go to a couple things with regard to the city. I know Eileen was talking about the opening of parks and marinas. And yes, the city of Miami is holding back until we reach phase 1 officially. The county has not reached phase 1. We'll reach phase 1 together when we're told so by the Department of Health at the state level. The data is very well protected. It's hard to get a hold of and it's hard to monitor, but we have to trust that the State Department of Health epidemiologists are going to tell us when we hit phase 1 with that 2-week declining trend of infections and positive tests. When we reach phase 1 is when the city of Miami will open parks, marinas, and even non-essential businesses to a 25% of their capacity. And that could be as soon as a week from now, 2 weeks from now. It's really hard to say because it's just not very accessible information. So Eileen and I have been working with our state representatives to try to fight for that information and really help make you aware of where we are in that trend, in that 2-week flow, because we just don't know at this point. But we decided from our perspective as a city, it wouldn't be ours to make a decision without the science behind it and let them tell us when we hit phase 1. But as a policy perspective, we would decide what phase 1 means. And so restaurants in phase 1 will stay exactly as they are, takeout and delivery only. But most businesses will be able to open. pretty much any business that's able to prove that they can operate within social distancing requirements will be able to operate, and they'll just be told that they have to stay within 25% of their normal occupancy capacity. And so that's going to allow us to enter a store or a workplace or an office with social distancing in mind. And the way we accomplish that is by encouraging to continue this sort of teleconferencing appearance for business if you can. And each business will be the steward of that. We're not going to dictate who gets to go into the building or anything like that. We're allowing businesses to open up as long as they adhere to that 25%. And so please stay posted, stay notified through my office, through my social media, Ken Russell Miami. If you look on Twitter, Facebook, Instagram, you'll find Ken Russell Miami, where I'll be posting as much as I can about what we can find out about data, how close we are to the phase 1, and when phase 1 actually happens. I'd like to mention a couple of the things that the county is also working on with regard to small business. The city of Miami has launched 3 different initiatives to help small businesses who are having trouble applying for assistance during this time. We have a micro enterprise grant for up to $10,000, a small business loan that is forgivable up to $20,000. It's forgivable if you keep your employees for a year. And then we have a general consulting contract with various entities that can just help your business, no matter how big or small you are, navigate all the aid packages that are out there. And so you can find out more about those either through my office at krussell@miamigov.com. It's KRUSSELL at miamigov.com. Or you can go to miamigov.com/community development. So those are the basics right now. I know there were some questions I received in my invitation with regard to compliance checks, with regard to construction. Sam, would you like me to go through those at this point?
Let's go ahead. I know there's some questions like that, similar, that will be coming up.
I'll hold off then.
What we wanted to do is we also have a ceremonial first question actually for you that Nancy will be asking, and then we wanted to give you an opportunity if you had a question for the rest of the panel, you're more than welcome to ask it also. So Nancy, I'll have you go ahead and ask the first ceremonial question.
Very Brickell specific first ceremonial question. People are very interested in getting access to Brickell Key and other green areas in Brickell. So I know you've explained a little bit, Ken, about the process there, but I don't know if people have specific information about Brickell Key being a little bit separate from the rest of the city. What's going on with access there?
So within the city of Miami, all parks, green spaces, recreational facilities fall under the city order, even though it is private property. So we expect the green spaces within Brickell to open up along with the remainder of the city of Miami green spaces at phase 1, at the point of phase 1. The very specific elements of how that will be monitored and enforced has yet to be published. I'm working with the city administration, through the city manager and the parks director, to set those guidelines out. But really, it's just going to fall into the basics of 6-foot distancing. I'm really looking forward to letting everyone breathe fresh air, get out in the sunshine, and just feel a little more healthy than they do cooped up in their apartments, condos, and homes. So I'm very much an advocate for this in the safest way possible, without a lot of complicated rules. But really, that should come with phase 1. As I said, we're just waiting to hear from the Department of Health when we've reached phase 1.
Great. Sam, is it okay to ask a question of Commander Ellington?
Please go right ahead.
So the other very Brickell specific, and I know our local commissioners know all about this, and I know both of you have discussed it, but a lot of concerns about enforcement of wearing masks, of social distancing when people are out, a sense that especially around Brickell Bay Drive and Brickell, over behind the church and the icon, people are feeling like there's a little bit too many people, and what could be done about enforcing and having people wear masks? Like, when is the time right for people to wear masks? How will we enforce that? Is Commander Ellington unmuted?
I'm checking. I just sent Leanne that note. Sorry.
Okay.
We
Might
may-
have, might have sprung it on her too fast.
Yeah.
But I know both of you commissioners have discussed this with her and with constituents. So maybe the two of you could start and we'll see if she pops on.
Sure. So the first thing to note is that the order for face masks does not include general walking around and exercise. It is certainly recommended, but there is no order in place to my knowledge, and Eileen, you can correct me if I'm wrong, at the county level, that mandates the wearing of masks when you're simply out walking around on the street. So that is not something that the police can enforce. It's certainly recommended, but that's not something that's in the order.
Yeah. The order is very specific. Grocery stores, pharmacies, public transportation. If you're on a bus, a trolley, a metro mover, a train, you got to have it. And then the order says kind of loose, any place where it's virtually impossible to be 6 feet apart. Okay, so that might be a small room or something. But Commissioner Russell is absolutely right. The order for just walking down the street does not exist. Now, the opening of parks, anybody that opens parks, because it's in the county order, the requirement is if a municipality decides when they're ready to make the decision to open their parks, people will have to wear masks in the park. And as I mentioned before, I really do think this is a first step towards an order that says we have to wear masks when we're out, because I don't know if it's going to be 2 months from now or 3 months from now or a month from now, but if we begin that slow pace of what do we do with indoor spaces, I really think that we're going to see more comprehensive mask wearing requirements. And so we may as well kind of get used to it. I personally have some cute ones now. The Marlins made me one, little Marlins logo. So anyway, I'm trying to be as fashionable as I can be with my masks now.
Right, but if you do notice places where people outside are congregating too much, they're actually not following the rules at all, and there's a certain time of day that you notice that, please, if you let us know, the commander can help with education and enforcement in that realm. She's done it for a few. I know Icon Brickell was having that issue, and they let the commander know, and the commander stepped up the presence in that area around the times when people were walking their dogs, et cetera, and it did make a difference. So please let us know.
Great. I think the commander actually might not be on, so that's good that you all could answer that. Would you all mind, maybe Senator Rodríguez and Commissioner Higgins, mind sort of going back a little bit to how does it work that some parts of the state are opening and other parts are not? What does May 4th mean for City of Miami residents versus county? I think there's still a little confusion about how the orders come down and all that. So I think a little clarification would help with several questions.
On my part, José Javier Rodríguez, State Senator, on my part, it's pretty easy. What was announced that will go into effect on May 4th does not apply to Palm Beach, Broward, or Miami-Dade. So with respect to statewide actions, at least for now, that could change. At least for now, the quote unquote reopening of certain parts does not apply in Miami-Dade. So it's totally, you should listen to what Commissioner Higgins and Commissioner Russell are reporting, because for now, the state does not apply.
Yeah, agreed. May 4th is for everybody else. We are on our own pace and our own timetable because we are more densely populated counties. And so our county and the municipalities within the county are going to make decisions that are right for South Florida.
So for our constituents, if you think you're special, it's true.
Of course.
Okay. There was a data question. I'm going to try to find it about, I think it had to do a little bit with the conversation around not feeling like we know enough about test results. Somebody, Mr. Marco, had read in the Tampa Bay Times that Florida medical examiners were releasing coronavirus death data, and then the state stopped that. And so they would like to know what our representatives are doing about avoiding data errors in COVID-19 and making the data more transparently available.
I don't know if
Sure.
Duran wants to say anything. I mean, the
Yeah.
only general, go ahead.
All right, Senator, thank you. I would say, and I've read that, I read the article at Tampa Bay Times, and it's with respect to how the data was being collected at the state level. And then what the Department of Health wanted to do was, instead of having different data sets, it all runs through them and they would release it. You're seeing right now there is a lawsuit with respect to all this data and whether or not the department is providing it with everybody. And so we have reached out and we have conversations and meetings set with the Department of Health, the Surgeon General, to talk through the efficacy of the data and to talk that through, because I think and based on some of the questions I've been watching in the box, it's why it seems like we have competing questions. Some are, why aren't we reopened, or why isn't Miami included within phase 1? And then you have other folks saying the data just is not compelling enough. It's not it doesn't have enough of the numbers that we think we should be seeing, and it's rightfully so why we're not in phase 1. So we have some conversations with the Department of Health, who has really been leading with respect to what data is shown. And you've seen over the last several weeks, days actually, nursing home data, long-term care facility data beginning to be shown. And a lot of this is because of our media has been pushing the Miami Herald, the Tampa Bay Times, and other media outlets have been really kind of putting lawsuits to push for this information. This is public information. And so we have reached out. We have been posing questions. There's a bunch of us, and really it goes to the heart of what we're trying to talk about here, which is reentry, reopening, in order for us to make smart policy decisions for the county, for the cities, for the state, in terms of when we are in phase 1. Well, we really need to know whether or not we're actually looking at the data. Do we have enough testing? Is it diagnostic testing there? Is the antibody testing coming to play? So we are having those conversations and actually have something in plans next tomorrow with the Surgeon General, a back and forth about this issue to see what is the justification, or is there one, or is there a way for them to explain to us what is going on here right now? And it's a bit suspect, if you ask me.
So I would just add that, and this is kind of really more of a summary of what you were saying. The number one issue, of course, we have is we don't have enough testing. And so that is the biggest driving force to the fact that the maybe questions about the data. Number two is, as Rep. Duran was saying, the Department of Health has their own criteria. Certain entities, for example, the county, sometimes people look and see the numbers coming from certain county health facilities, and they don't seem to match what's going on at Department of Health. They have different timelines and criteria as how they release information. So there are slight differences between some local data sources and what Department of Health puts out there. And I think one thing that I think, frankly, is something that I wish were not the case, but we do have a transparency issue. Rep. Duran was mentioning, DeSantis and Department of Health have been sued. I believe also the Agency for Healthcare Administration have been sued about how they release records. And to be honest with you, this is a fight that goes back until February. I was really engaged with the governor's office and Department of Health, even back in late February, before we even had any confirmed cases. They were interpreting some of our public record statutes in ways that do not match what, frankly, the letter of the law is, how it's been interpreted by the Attorney General. And, even Governor Scott, again, during Zika, applied the law correctly in terms of how information was released. That has not been the case here, and unfortunately has not been corrected. So there are issues with it if you're seeing it, and I would consult various data sources. But that's all I'll say.
Could I comment on the data as well from a city perspective?
Yeah, and I'll do county too. Go ahead, Ken.
Thank you. It's been very frustrating for us as a city, and I've been working very closely with Representative Duran and the senator as well, and they understand our frustration. The data is not parsed out by City of Miami, for City of Miami directly. It was just set up incorrect. I don't believe it's out of malice in any way. I think it was just set up incorrectly to be locked into zip codes. And we do not have clean lines for zip codes. Some of our zip codes run into Coral Gables and run into other cities. And so instead, the state has just lumped the City of Miami in with unincorporated Miami-Dade, which is over 1 million people more than we are. And so it's very difficult for us to make policy decisions. And as you've seen, we do have a very different set of criteria we're working with in the City of Miami. We have a different fire department, a different emergency operating center. And so we're trying to make the right decision, but it's hard when we're in the dark a little bit on the data. So what we've decided as a city is to follow the county's data. And what we do know is that in the entire state of Florida, with the over 33,000 cases right now, a third of those are in the county, and a quarter of the deaths are in the county. So we are the epicenter for the state. I'm glad we're not included in the statewide opening for May the 4th. And so that gives us the freedom. That sets a floor for us to be more stringent than the state or the county at the city level. But still, we're waiting for that data. Beyond just that zip code issue and the city parsing its data, which is very important for us down the road, because for us to seek reimbursements and understand, we need to know how many infections we had and how many deaths we had. And it's very simple information we should have access to. The most important thing for us to know right now is where we stand with regard to the 2-week trend on testing and percentages of positive cases. That was on the state's Florida disaster website up until last Friday. But as of last Friday until now, I have not been able to find the Miami-Dade summary for 2-week trending. That may exist elsewhere, and I know my colleagues are trying to help me find that. But as soon as I have it, I'll be transmitting that to the public as well on my social media and newsletters, so you know kind of where we stand in terms of phase 1.
And I'll just tell you, for the first couple weeks at the county, I'll tell you what we were managing. We were just managing available hospital beds, right? So while we asked everyone to stay safely at home, the entire county system was really all about how many beds do we have? How do we get more beds available? How many ICU units do we have? How many converted into ICU? How many ventilators we have? How many anesthesia machines do we have that can be converted into ventilators? And it became, we were actually having a hard time getting hospitals to even report that data to us. And so Mayor Jimenez issued an executive order which required them to report it. And so we actually have had since that day, at least at the hospital level, number of patients going into the hospital in the day, number of that are in ICU, number that are on ventilators, number that have been released. And so we now have at the local level almost a month's worth of trends on what's going on with the hospital, because we are going to find more cases every week because we're doing more testing. But and University of Miami has been helping us do some incidence testing with we know the antibody tests are not particularly accurate, but we can get a flavor of what's out there in the general population, which is, early on saying at least 100,000, maybe 200,000 of us already have asymptomatically had and recovered from this. But the hospital capacity, I can assure you, is better than it was on March 1st. We have less COVID patients, we have more ventilators available, and so that is one thing that has been managed extremely well by the entire network. And I know maybe Congresswoman Shalala, she's been tireless in talking with all the hospitals because of her role. And I don't know, maybe Congresswoman, the testing money that Congress put out, how are you envisioning that might be used here, either at the state or in Miami-Dade County for us?
Well, we actually are giving a lot of it to the hospitals to pay for testing. But the fact is we don't have enough testing. The data is totally screwed up, because if you live in a city that has a hospital, they're going to count the people that passed away in that hospital for your city, even though they may have not been a resident of your city. So it's very difficult beyond the county to actually get appropriate data. But let me say this, no state in the union has reached stage 1. So this state has made a decision to open up part of the state before we actually have enough testing and enough data and enough time to meet the CDC standards. So the governor is taking considerable risk. And because of pushback from South Florida, which is trying to keep to scientific and medical advice, we were excluded. It's not because of politics particularly, but it's because our leaders here, including all of you, are very wary about opening up without enough testing, without enough data. This is about data, not about the date. And we don't have the level of testing that we need in our community to be able to open up. Opening up parks and things like that it's very different from opening up restaurants and other kinds of businesses. So I am very worried about the fact that we don't have the depth in testing that we need in our community, and we just don't have our arms around this. And the scientists will say to you, once you're on a downward slope, it takes 14 days before we really know whether you're on a downward slope. And we really need to starve this virus down to 1 so that 1 person is infecting 1 person, and then to do tracing and to do isolation. I noticed there was a question about why don't we just isolate all the people over 65? The fact is that in our community, people have underlying conditions, and you can't do it just by age. We have young people that are passing away in our community once they're infected, and we don't know all the reasons for that. So I am very worried about the pressure political leaders are getting to open up.
Eileen, on the bright side, is it fair to say that, or is it accurate to say that nobody in Miami-Dade County has died for lack of capacity of ventilators or beds?
No.
And is that a testament to the stay-at-home and social distancing?
Yeah, I mean, basically, it's all hands on deck. The hospitals and the county made sure that we had beds available, vents available. We built 2, we still have them. We have 2 field hospitals at our parks, and we have a field hospital, 500-bed field hospital at Miami Convention Center. We're not taking them down, just in case, right? There's no reason to. So we never, ever had a problem with access to ICUs, ventilators, care. And the hospitals were great at coordinating so that no one hospital was overrun, that they could always be sure to treat everyone very well. And even the children's hospitals, they were really good before, as we were ramping up. They had one hospital was going to try to take care of kids that weren't COVID related, and another that was going to deal with kids with COVID. So I will tell you, behind the scenes, what the hospitals did to get ready was fantastic. And we, PPE has been a nightmare, but our hospitals have had what they needed. So we have not run short on PPE, and we have managed to do the same for all of our, particularly our firefighters and our EMTs who are out picking up patients and giving them their in-home tests, and police. And it's, we're still risky, and we worry every day that we don't have enough, but the hospitals in Miami-Dade County never had one day where they were worried about capacity and PPE, and that was preparation. And by the way, Jackson, when they saw this happening in China, they went on and they ordered medicines and they ordered PPE in January. So, so we were stocked up for that. And then
but we're still not testing everybody in the hospitals. We're still not testing the people that are cleaning the hospitals. We're still not testing everybody in grocery stores. or in drugstores. My concern is that the people that are out there working are not being tested.
So just to wrap up the testing questions, and then I think we need to move on. Who would be responsible of all the entities to make sure we do get more testing in South Florida? Is it a very clear chain of command? That's a question that we have right now.
The answer is no. The federal government is providing some testing equipment. The state is purchasing some, and frankly, it's the wild, wild west. The hospitals are out getting their own, and their difficulty is there are different kinds of testing machines, and you have to buy the supplies for each of those machines, and the companies that own those machines, they're proprietary, are not giving us enough long-term. They're supplying, but they're not getting a month's worth of testing supplies. So it's I have a bill that says the federal government ought to use the Defense Department procurement stuff to order all the tests, to negotiate the prices, so we don't have states negotiating against each other and hospitals competing against each other. I mean, it literally is a mess.
Yeah.
And what's good is that we're getting a lot of testing done, but it needs to be targeted before we open up. These essential workers all need to be tested.
Great. Thank you, everybody, for answering so many questions. We had a lot more like discussion type questions and a few others that I think we'll be able to handle offline via email. We can get a report out of the questions, and we will work, Sam and the Brickell Homeowners Association, to get some of those one-off questions answered. Thank you.
Yeah. Can I just say that all of us have all this information on our websites. We all have gathered all the information. We all have all the information on our websites, so that people in the community can go to our websites to get answers to the questions, but more importantly, to get information about what services are available.
Perfect. And actually what we'll do is we'll make sure we have links on the BHA website and our neighboring association websites to their sites so that you can get the latest information. We also, just so you know, all the questions that were submitted today will be addressed one way or another. As Nancy said, through BHA and through our representatives, we want to make sure that we get you answers. If you think of other questions after the event today, please feel free to send them to me or to any of your representatives' offices, and we will make sure to address them. I want to turn over the floor very quickly to Abby, who is with our Director of Communications at BHA. Talk to you a little bit about some calendar events that we have coming up, meetings and other things that you might be interested in.
Hello to everyone who's watching. A special thank you to all of our participants. Just wanted to update everyone who's listening. We are having a May membership meeting on education and awareness coming May 21st, followed by a membership meeting in June on lobby training. There's a lot of young folks, just a lot of people in general, who are interested in getting more involved in politics and how to go about it. Thus, we're going to host a training on June 18th. In July, we're going to have a BHA candidates forum where we want to get our county and school board officials, our county and school board candidates together and share their vision for our city. In September, we'll have a membership meeting on legislative agenda updates, which will invite all of our county and city leaders to join us. We constantly update our website, and we have a lot of content that we push every single day through our social media channels. So we encourage everyone to follow us on social media and to stay connected with us, because we post and send out weekly emails, and thus we have valuable information that we'd love to share with all the residents that are listening, as well as our city leaders. So that's what I have coming up, and thank you for allowing me to share.
Thank you very much, Abby. Let me echo the social media. It's been wonderful. If you haven't been on BHA social media, BHA Miami, it keeps you well informed. And I know we follow all of our political officials, and so we get the latest news up. The last thing I wanted to talk to you about is a new organization that BHA has helped parent and is announcing. It's an advocacy organization called the Urban Core Community Coalition. We see this new organization as a way to really kind of organize all of the communities, all of the neighborhoods and stakeholders of folks living in the urban core to really make sure that the issues of the core are not only heard, but also acted upon at every level of government. As you saw today, that was the example of having this event today, is to show how the core is being served, and that to make sure that our unique challenges and issues are always at the forefront. We'll be sending out some news on our website and also blasting out some information to you about the organization and how everyone from an individual to neighborhood associations can join and be part of this effort. As Ernesto said, this effort is really to look at how we can build the future leaders of tomorrow for our community and to assure those leaders have all of the information and also the backing they need to get the work done for us and for the urban core. We'll have some announcements in May and June. A website will roll out over the summer. And then hopefully our first event, public event, if situations allow it, will be the 3rd annual Urban Core Education Forum, which we're rebooting. If you'd like to learn more about how to get involved and about or setting up an informational session for your neighborhood or your association, please send me an email, make a phone call to BHA, and we'd be happy to talk to you about that. But look for that on the horizon. At the end of the day, we hope that soon the urban core and its issues will be top of the line as far as issues being taken care of. I want to thank everybody for coming out tonight. We ran a little bit over, but it was well worth it. Wonderful information. And we look forward again, as I said, to doing this again. I want to thank our co-hosts again, the Downtown Neighbor Alliance, the Roads Miami Association, Brickell Area Association, the DDA, all of our presenters. Thank you, Congresswoman, Senator, Representative, Commissioners. We really appreciate you taking the time to come and really talk to us and let us know about how it is we can get to that better promise of a urban core where we can all live, work, and play and learn safely together. So if there isn't anything else, Ernesto, I think that will be it, and we can call the meeting.
Again, Census 2020 is extremely important. We need to finalize that census and register to vote. We are going to help to change the political arena in the city of Miami. We young people, we have potential, and we will do it. God bless America, God bless Miami, and thank you all.
Thank you, everyone.
Thanks, everybody. I miss you in person.
Thank you.
Have a good night.
Night.
Thank you.